Hi everyone, welcome to another video from our COVID-19 series. I'm Sam Kasser, the chair of the Communication Committee here at ASFA, and today I'm pleased to introduce Dr. Kate Parker and Dr. Lauren Arundell from Deakin University. We're going to be having a chat about their latest research and to hear what the next steps are in terms of their findings for COVID-19. To get us started, I might pass off to you guys if you want to run through just quickly your research interests and maybe a quick introduction into the study and how you've gone so far. I'll leave this up on the screen as you quickly introduce yourself.
Sure. I'm Dr. Kate Parker and I'm a lecturer in physical activity and health at the School of Exercise and Nutrition Sciences at Deakin University. My research focus is looking at clustering and trajectories of activity-related behaviours, so your physical activities and sedentary behaviours during childhood, adolescence and young adulthood. And I've got a particular interest lately in tailoring of activity-related behaviour interventions based on the unique needs of different adolescent subgroups.
Thanks, Sam. Thanks, Kate. My name is Dr. Lauren Arundell. I am a postdoctoral research fellow at the Institute for Physical Activity and Nutrition at Deakin. And my research focuses on children's physical activity and sedentary behaviour, their screen time, and working with children and families to create interventions and programs that can be implemented in the home setting and also the school setting.
Fantastic. So welcome, we're really excited to have you guys on board today. I think I'll just start off by getting you to jump into your current research and what that's looking at and how that came to be.
Sure, thanks. So myself, Kate, and a great team of researchers at IPAN put our heads together and realised that this COVID-19 pandemic is going to have such an impact on physical activity across different age groups and across different population groups. So it's really important that we are looking to try and find out what's happening in terms of physical activity and sport and screen time for Australians. And so that's where the Our Life at Home study came to be. And so the aims of the study are to be looking at these movement behaviours across 2 years. So it's a longitudinal study over 2 years as the pandemic and the restrictions increase and decrease, and to see what's happening with these behaviours with the different age groups, and also what the impact is on health and wellbeing and what the factors are that are influencing these behaviours. Obviously, there's going to be impacts from a high level policy level, and obviously the physical environment and also the change in lifestyle, because people have been at home for periods where they've never been at home before. So how this change in lifestyle is impacting our behaviours.
Perfect. And in terms of, I guess, the domains and settings that you're looking across, Kate, did you have anything to sort of mention in that regard?
Yeah, so we're looking across, different domains such as, the school-related behaviours, active travel, recreational and gym facilities being closed, and then as they reopen as well as obviously the home setting, which most people are spending the majority of their time in right now.
Perfect. And so I know you said it's a 2-year study, but would be interested to hear about if you've got any sort of key take-home messages from some of the early results that might have come through from the survey so far, particularly that you think might be of interest to the members for ASFA.
Yeah, so we've got our baseline data collected and we're starting to analyse the data now. And the data that we have collected really provides us with a unique opportunity to look at the different sort of subgroups of the population, different age groups, different states that people are living in, socioeconomic position, for example, and how they may have adapted or changed their behaviours in terms of physical activity and sedentary behaviours in different ways. So some of our early findings are suggesting that, yes, the restrictions definitely have impacted these movement behaviours in different ways, particularly among different age groups. So it sort of means that moving forward, we're going to need to provide different strategies for children, adolescents, adults, older adults, for example, to help them remain active not only during times of restrictions, but also, when gyms and recreational facilities and sporting organisations do open up once restrictions are eased. And we are finding that some people are capitalising on the change in lifestyle, for example, and that people are finding different ways to remain active. So walking out and about with families has increased, and a large proportion of people are using digital platforms, so YouTube videos, apps, websites, and subscriber fitness programs to remain active in the home setting.
Fantastic. Anything to add to that, Lauren? Is there anything from your perspective that you found sort of particularly interesting so far?
Well, yeah, sort of leading on to what Kate said, one of the really interesting things that we are able to do with this data, which I think will be particularly interesting moving forward, is that we can look at different groups and of interest. So, for example, those that were using recreation facilities, those that were engaging in strength training, for example, at the gym beforehand, how have they adapted? How have they now changed their behaviours? Have they changed them, first of all? Are they now doing these strength training activities remotely at home? Have they changed their behaviours? Are they now running outdoors? Or have they reduced their behaviours and are no longer being active? So that'll be really interesting in terms of behaviour change immediately, but then also how can we re-engage populations that have changed their behaviours during this sort of restricted period, and so that sort of transition back to whatever normal life may look like. But as facilities start to open, you know, who are the ones that are taking them up, and what are the reasoning and the rationale behind taking up back to recreational facilities, and also to sport. There's obviously a big interest and a big focus on how we can get people back to organised sport. So it'll be really interesting to find out from the people that were engaged in sport what has impacted their, obviously, stopping of sport, and have they still been engaged with their organisation, and how we can get them back to sport. What are the big barriers that are in the way, and what can clubs and sporting organisations do in order to help facilitate that return to sport. So it should be really interesting.
Yeah. Absolutely. Sounds like some interesting findings so far. I guess from our perspective, one of the key aims for ASPA is that we do link up research with policy and practice. And so it'd be interesting to hear if you've got any sort of early learnings on what you think might be of interest for those sectors, and how this research might sort of inform some moving forward progress in that area. Yeah.
Yeah, absolutely. And that's something we've been really conscious of from the start. And, you know, our colleagues have got some great, you know, historical relationships, and they've done some wonderful things in working with really important key collaborators and key stakeholders. And so we've really wanted to continue on that pathway, because we're wanting to have our data at the end to be usable and to be informative and to be actually applicable to the population and the stakeholders and the organisations that are going to need to do something for activity, for physical activity after all this, you know, I want to say ended, but I'm not sure if that's the word, has moved on. So we've got some great input, and we've got some great support from key national government and non-government organisations, from the education, from the health, from the sport and rec areas, and also from the transport. And so it's been really great to be able to tailor the questions that we're asking to obviously be able to answer questions that are relevant from a physical activity perspective, but then also what are the factors that are going to be important for promoting physical activity afterwards, and how is that going to be usable, and how can it be used to create policies and programs and strategies to help people be active or to re-engage in activity, and how can that be implemented given the current situation. So, you know, we often have had to hit the reset button in terms of strategies that we've used previously, because all of a sudden the context that they're applied in is so different. We can't say, you know, we can't encourage walking and cycling to school, for example, as we have previously, because their kids aren't at school. So how do we then tailor the message to be appropriate to the environment that they're in? And not forgetting, obviously, when they do go back to school, to go back to the cycling to school messages. But working with the stakeholders and organisations, I think, has been a really great opportunity to produce data that's going to be useful.
Yeah, absolutely. Yeah. Kate, are there any sort of important or key alliances that you think might come to the fore in this, I guess, hopefully post-COVID-19 period?
Yeah, as Lauren said, you know, we are working with a number of different, you know, government departments and organisations, and in particular, sort of the transport sector and local government, where really it's going to be really important to help ensure that our local neighbourhoods and environments have safe and appropriate walking paths and tracks and recreation facilities, I guess, and green spaces for all people to use and get out and about and be active. And in regards to the education sector, during these additional periods of restrictions that we're facing now, particularly in Victoria, and we may face along the way again, we need to ensure that our students are having activity and physical activity prioritised during their remote home learning. And as Lauren mentioned, you know, really engaging with the sport and recreation sector to help get people to return to the organised sport and active recreation.
Yeah, absolutely. there's definitely going to be a lot to unpack as you work
Oh,
through some of
absolutely.
those results.
There's a wealth of data and information that we're collecting, which is really exciting, but also,
Yeah.
A lot of different opportunities that it's giving us. Yeah.
Yeah, certainly. I guess it's interesting from our perspective to hear from our members on how they've stayed active during this period. And so we've been asking our interviewees if your routines changed, what you've been doing, how you've kept active with your family, I guess maybe during the first lockdown period, and if potentially that's changed now that Melbourne, where Deakin is obviously located, is in its second round of lockdowns. So yeah, we'd love to hear how you guys have used some of your findings that kept yourself and your families active.
Yeah, so as Lauren mentioned before, we're really interested in looking at whether people who maybe used gyms and recreational facilities before, if they've adapted, and that's my situation. I did used to attend a gym and to do pretty much all of my sort of exercise, I guess. But now with the closures of the gyms, I'm spending more time out walking with my family, going for family bike rides, and also utilizing YouTube for some yoga and Pilates exercises, which has been a complete shift in the type of activity that I usually do, but it's been enjoyable and nice to do something different for a change.
And we've been trying to keep active as a family as well. We still, each day try to ride to school. So we go for a bit of a bike ride before we sit down and start classwork. My daughter's now doing her dancing via Zoom, which is really great opportunity for her to still be engaged with that. And for myself, running in the neighbourhood walks and now doing some app-based fitness classes as opposed to at the gym. So trying to maintain activity, but just the forum and the format that it's done in has definitely changed.
Yeah, great. Good to hear that you're keeping active. Lauren, I think that would be really interesting to hear what your ride to school idea looks like. What does that involve?
Yeah, well, it's literally get up, have something to eat, and then jump on our bike. And there's a park not too far away, so we do a couple of laps of that, and then come back. And it's just become part of the routine, which is really, really nice. We actually do go past the school, which is a nice little marker in the morning to sort of say hi to school, and then come back home and do the schoolwork, which is kind of unique.
But I think that's a great idea. It's something that I didn't think of, but maybe I should start doing that as well. I like it.
Absolutely. I guess just as we wrap things up, it's really important for us to as a society, think of how we can, I guess, help progress your vision for physical activity in the future. So we'd be interested to hear how you think ASPA can move things forward for physical activity, and maybe in relation to this particular research project.
Thanks. And thanks for this opportunity to share the information. We're really excited. We're hoping to get some first lot of data and results out really soon, hopefully in the next sort of weeks to months. So we'd really like to share that with the ASPA community. And we'd also be really open to talking about, with other people who are doing similar research or who might have an interest in this area. And, perhaps there can be some alignment with our work. So, we'd love to hear from people out there.
Fantastic.
Absolutely.
I guess that sort of brings me to the end of my questions here, but if there's anything that you guys wanted to add, then I'm happy to do so. We will obviously be highlighting the research on the website and on Twitter. So if there's anything that you'd like us to share, then please let us know. But again, thanks for your time today. And it sounds like there's a lot of work to be done moving forward. So hopefully we see some findings in the not too distant future.
Yeah, absolutely. Thanks for the opportunity to speak with you today. It's great.
Yeah. Thanks, Sam. Thanks, Aspa.